Hi, and welcome to Healthcare Information Technology Opportunities in a Non-Traditional Setting Physician's Office. My name is Yvonne Diaz, and I'm a student of Santa Fe College. There's a diverse amount of healthcare settings that would benefit from the skill set of a health information technologist and what we bring to the table. Most people think that the only place of employment is the hospital setting, but this is not true. With a push for electronic health records as an industry standard, more and more traditional and non-traditional facility settings are opening up, and a medical doctor's office is a great opportunity, and it's a great place to work. So, what is a medical office visit, and how can they benefit from an HIT professional on staff? When a healthcare when healthcare services are provided by a physician and his staff in an office, it is considered a physician office visit or clinic visit. The main goal of this visit is to maximize the physician patient relationship in order to obtain the sufficient amount of information the doctor needs to diagnose and treat the patient in a cost effective way. Um, the HIT professional can help the physician in many ways with the medical record and many other different opportunities. From setting up the initial appointment to coding, billing, medical record maintenance, and just running the office, making sure that everything runs smoothly, the HIT professional can make a big difference. A good example of this would be in Gainesville, the HCA Florida Gainesville Primary Care Office, which is located at 6900 Northwest 9th Boulevard in Gainesville. They have a satellite office in Tioga, Florida. HCA is a national healthcare organization system that usually owns hospitals and ancillary services, but now they're getting into the primary care um, business of healthcare. They the physicians that are employed there are not the owners, and they're part of the staff. There's six medical doctors, one DO, doctor of osteopathy, and three nurse practitioners in the facility. They provide family medicine, which is a division of primary health care that provides comprehensive care of the individual from all ages, and it focuses on holistic approach to healthcare. Um, it focuses on disease prevention and health promotion and has complementary services like diabetes management, vaccinations, and pap smears, to say a few. The revenue cycle, life cycle for a physician office is a good method to control costs and make the practical, uh, profitable while providing appropriate quality care. Remember, that's the main goal, the quality care. Most people believe that the life cycle starts with reimbursement, but this is not true. It begins when the patient actually calls the office to obtain a visit. Vital demographic information is provided and must be verified. When this is done correctly initially and free of errors, the reimbursement process is more timely and more efficient, and it can't be overstated its importance. In 2021, the No Surprise Act was enacted, which requires all physicians and providers to provide a good faith estimate of of um, of what the services would be in advance, and for all self-paid patients. Self-paid patients are patients that have no insurance and they pay the services on their own. Um, on the day of the visit, services are obviously rendered, and all copays and deductibles are are collected at the time. Um, Documentation is very imperative for coding and billing, and good data capture is the key. The next step would be to actually take that information, that data, and send it to the third party payers. This is done with ICD-10 codes, CPT codes, and HCPCS codes, and it is placed on the CMS 1500 forms for physician billing. And lastly, once the third party payer receives the bill, they will either send a payment or a denial with a remittance notice. And that remittance notice is information of why they denied it or they paid it and what the next steps to follow. And then there's a accounts reconciliation where someone in the office would sit down and reconcile the accounts and make sure that the maximum payment has occurred. All these steps are vital, and an HIT professional would fit in perfectly. Okay, so let's take a closer look at the billing and coding aspect of the physician office. How do they get paid? Um, as earlier stated, the only form allowed to bill is the CMS 1500 form. The same form in the electronic version is called the 837P form, but it's the same form. ICD-10 CM codes are used for diagnosis. CPT and HCPCS codes are used for procedure and supply coding. Physician billing is really a three-part process. It begins with choosing the appropriate codes for a diagnosis. The next part would be to choose correct CPT and HCPCS codes. And then the last part is really part of CMS. It's the CMS determination of the appropriate fee based on resource-based relative value scale, um, which we'll go over in the next slide. Okay, so what is that RBRVS, resource based relative value scale, and what is used? It's composed of three components that are called RVUs, or relative value units. And they are divided up into practice expense RVU, malpractice expense RVU, and work expense RVU. Practice expense RVU is what it costs to run the office. This would include rent, administrative costs, and supplies. With a high cost of malpractice insurance, CMS also incorporated a malpractice expense RVU. And the last one represents the value of the physician's actual work and their knowledge. And um, and since there's a large discrepancy in what the cost of doing business is in a rural versus urban area, CMS multiplies these RVUs by a geographical conversion factor. And then this conversion factor helps alleviate higher rising costs of medical practices in certain areas. So, financial challenges in a physician office. Um, I spoke with Jacqueline Hernandez, who's the director of cardiology practice for Baptist of South Florida, which is a huge healthcare organization in the south portion of Florida. And what she stated was that after the pandemic, there was basically three financial challenges for the physician office. The first one is staffing. After the pandemic, there worldwide we see a large amount of need for ancillary staff, and um, and it's needed because there are some procedures and services that the physician can't do alone, and can't the services can't be rendered without the staff. The next issue would be a time issue with prior authorization. Some procedures require prior authorizations before rendering service. Since the physician is the first source of care for the patient, they become like a gatekeeper for this for secondary care services such as hospitalizations. This work is very time consuming, and it's not reimbursed by the third party. Lastly, it's the CMS physician rates. Although, like we said, wages and supplies have gone up, reimbursement rates have actually declined. There was a 4.6% decrease in physician reimbursement from CMS that will begin in 2023. This makes it harder for medical practices to cover costs. Creative solutions such as sharing staff and workspace um, will be seen more in the future. Okay. So, opening a medical office involves many federal and state requirements. Um, Basically, public health is largely policed by the state, but there are certain issues that the U.S. Congress has addressed in its regulations. One good example would be the Stark Law of 1992, which prohibits physicians from self-referral, and they both hold a monetary and imprisonment penalty. The law basically states that a physician cannot refer services to a company in which they or their family have a financial interest, and there is a fine up to $15,000 per claim, and there's also three times the amount that needs to be reimbursed back for each claim. And imprisonment or fines can also occur. Another federal law is the anti-kickback law, which basically states that it becomes a felony for any type of remuneration for referring a patient to an ancillary service, which includes gifts, money, trips, or anything of monetary value. HIPAA was enacted in 1996, and it was in place to provide and secure medical records. Um, and although there are not a lot of federal laws that apply to physicians in the office. All laws must be adhered to. Okay. State laws, Florida state laws are seen in 485.301 to 485.351 in the Florida statutes. And they basically state all the regulations for running an office. Okay. Now, Medicare and Medicaid are the biggest providers of healthcare for the U.S. at the moment, and they developed a set of rules called um, conditions of participation (COPs) or conditions of coverage, and then these rules must be adhered to in order to become a participating provider. CMS has used approved organizations, accrediting organizations like JCAHO, um, to make sure that these participations requirements are adhered to. This is called a deeming status. And the coding schemes that we already spoke about are here. Um, and these are the only ones that are allowed for physician office visits. Okay, as technology advances, HIPAA becomes a bigger and bigger role, and their policies must be adhered to. The two big issues is privacy and security. Privacy concerns with medical records being protected and preventing unapproved access by others. And security is occurs when someone physically tries to break into a device. And these two issues have a big financial burden if they occur and can endanger the patient. Policies and procedures and training of staff must be in place to ensure that privacy and security issues do not occur. It's an exciting time to be an HIT professional with lots of work opportunities. One great place that doesn't fit the traditional setting is the physician office and MD office. Um, all the rules and from the state and federal must be applied and worked in, and the HIT professional um, is an asset to the physician